Hi, it's Dr. Cari again. Okay, so we're back and we're going to talk about SIBO and the treatment of SIBO. We're going to first talk about the diagnosis of SIBO. So diagnosing SIBO is done primarily through something that's called a breath test. And you blow into these tubes and you collect your breath after you have sort of starved the SIBO and then fed the SIBO a really rich diet of the type of sugar that it loves to eat, and then you measure how much gas is produced. People with SIBO tend to produce either a high methane gas level in their intestines or a high hydrogen gas level, and that really can determine whether or not you have bowel disturbances and what those bowel disturbances look like. So it's a breath test. Now, if you do this breath test, it is super important that you read all the instructions a couple weeks beforehand, because you have to really prepare for it. There's a lot of things that can interrupt with this test, and nothing is worse than doing the whole test and at the end having it be, wrong, just the lab throwing it out because it was done improperly. So read the instructions and make sure that you are ready. You're not taking anything that's going to interfere with the test. Make sure that you eat the diet exactly as they say. They talk about doing steamed proteins. Do not, or baked, do not fry your food in oils. All of those little things can make a difference in whether or not we get a false negative or even worse, a false positive, right? You certainly don't want to spend months and months of your life trying to heal something that isn't really going on in your system. So let's say, okay, you got a SIBO diagnosis. Okay, we take a deep breath and we pause. What exactly does that mean for us? Well, it means that, like I said, you've got this overgrowth of bacteria in your small intestine, and that overgrowth can really affect our health negatively. So we want to take some steps to deal with it. But what we don't want to do is we don't want to run out and start being prescribed a whole bunch of antibiotics, because overuse of antibiotics is one of the things that can give you SIBO. So can chronic constipation, that can give you SIBO. Almost any digestive imbalance that goes on long enough can end up leading to SIBO. So for me, it was overuse of antibiotics when I was 17 years old that led to SIBO. And so if you have had any kind of chronic health issue, you're having some chronic digestive issues, it's just a really good idea to get tested to rule it out. It's a very inexpensive test. It's a little bit of a pain, as I said, but it's a very inexpensive test. So let's say now that you're positive. What do we do? Well, then we have to assess some things. We need to know whether or not you're producing enough hydrochloric acid. And this can be done through very specialized testing, or it can be done through some just simple things in the office. We also need to assess what your stomach lining is like. Is your stomach lining robust and thick, or is it thinned out? So that we know what measures we can take in working with the SIBO. So in some cases, we might start off a SIBO protocol with antimicrobials. But the most important part of any SIBO picture is fixing the function of the digestive tract. So you might use antimicrobials to weaken it, but then you have to follow up with fixing the whole digestive system, making sure that the hydrochloric acid levels are high enough in the stomach, making sure that the pH is correct by the time it gets to the small intestine, making sure that the transit time is good and that things are moving smoothly through your system. If you skip that step, you're likely just to get SIBO back. Now, I have to tell you, there's another piece to SIBO that I find to be super important that you can't overlook. And it's, why is the SIBO there? So after my 18 years of working with people, one of the things that I find is very often our health challenges are there because they're helping keep in place an emotional reality. So if we have an old emotional programming, or what I call outdated survival programming, which is saying to your body that you're not good enough, or that it's not safe to be the fullness of who you are, very often these health challenges, these chronic health challenges, are kind of answering that call and helping to suppress your vibrancy so that you don't have to go out in the world and put yourself in a dangerous situation. So again, If you think you have SIBO, make sure that you are working with somebody who knows how to handle SIBO. Like I said, it is very, very, very specialized, and if done incorrectly, you can end up in just this vicious loop of it reoccurring. It has a very high reoccurrence rate, and you can even end up much worse. I have seen clients ending up really, really, really depressed because they went about treating their SIBO through the standard medical route. I have seen clients just end up with the symptoms coming right back because they didn't follow up. They did the antibiotic therapy and they didn't follow up with a digestive repair, and they just ended back up in that loop. So please don't let that be the case with you. If you have the symptoms I've talked about, get yourself tested, and once you're tested, make sure you're working with somebody who really knows how to handle SIBO. Anyway, sending you all so much love, and I hope you're enjoying this beautiful, beautiful winter season.